Welcome to Canada's podcast.
At Silicon Valley Bank, we help innovative technology and life science companies grow. If you're ready to take your next step, discover how Silicon Valley Bank's founder-friendly financial solutions, industry insights, and connections can help you move your bold ideas forward fast. Go to www.svb.com/Canada/connect. Take your next step with Silicon Valley Bank.
Hi, this is Celine Williams, hosting from Ontario for Canada's podcast. My guest today is Dr. Jim Feng, who is a mission-driven serial entrepreneur and founder of Phyxable. Alongside his chiropractic degree, Jim is also a certified strength and conditioning specialist and medical acupuncturist, and has directed medical teams for world championships, professional and Olympic level sporting events in the MMA and wrestling. Welcome, Jim.
Celine, thank you so much for having me today. I think it's going to be a fun conversation.
I definitely think so. I'm very excited. First of all, your background with all the sports is super cool. So I'm sure we will get into some of that because that is definitely very unique. And I'm going to ask you to tell me a little bit about your journey to get to where you are now and what you're doing now, which may get into some of those sports pieces. So I'd love to hear a bit about your story. How did you get to do what you're doing now?
What's the short version or the long version?
We got time. We got all the time.
All right, sounds good. So when I was born, I'm just kidding. Actually, I think the main thing when it comes down to Phyxable is because of my journey with pain, physical pain. So Phyxable, just let everybody know, we're an end-to-end virtual rehab platform. We help people out of pain, physical pain, work towards prevention, and then helps certain people work on performance, like running their first 5K and actually getting moving and changing their lives there. So for me, I was a chiropractor. I graduated back in 2009, and I opened up clinics. I integrated them, franchised them. So I really understood, how to get people better. And I got into the profession really because of the sport of wrestling. I think you mentioned some of that in the past, and I grew up in a not so great area, Malton, for all those people from Malton. So the ghettoplex, if you will, and it was really for this. If it wasn't for the sport of wrestling, I'd probably be doing like a lot of bad stuff in my life. So it really kept me off the streets, and because of the sport, I really dedicated my time into it. But I had tons of different injuries, and I would have to travel an hour and a half on a bus with my 2-year-old sister, who I was babysitting, across the city to get therapy, then go to practices with her and come back. So I had always had injuries. The sport of wrestling is literally, it goes hand in hand with injuries. So, and I just saw like all the different types of therapies that we were getting and what was good, what was bad. And when it came down to it, it really came down to the active component, the training and building your foundational self, building that armor, right? So the more I looked into it, the more I knew I wanted to be in the field of rehab and, getting people better. So that's why I got into the chiropractic field and did more advancement of that and got people better. And I think from that journey, I really understood how to get people better. And the majority came down to activating them and engaging them. That education is extremely important. And I think it should be evidence-led, meaning based on research with best clinical practices and putting it together in a reformulation. One of the key things we were missing here was engagement. Like, it's great that you come in like once a month or, for a quick treatment for your back and then you're back to the same place you were at. More importantly, there's ways to kind of prevent these things, like working on core foundations as you sit back up, right? And get posture up. These preventative things are extremely important. And there's a formula out there. There's solutions, and it's based on evidence, and it's about doing. But unfortunately, people are lazy. We're lazy. I'm sure you're lazy to some degree, and majority of people watching today would rather sit back and do nothing than do a little bit of something when things are not actually hurting. So really build Phyxable for prevention, but we learned quickly that people are lazy, and you really needed that stimulus of pain to get them started. So we built trust around that with a virtual call with the practitioner around Canada and in the States, and then from there we give them a guided solution in the digital solutions with ability to message your practitioner anytime. And we're building really cool augmented reality to show you if you're doing your movements mobilization, stretches, those foam rolling properly. And I think it's well crafted to really engage you, to kind of use the same hacking technique Facebook's and Google's doing to make you click through to do better for you. And so we really came to this game to do that for people. And then I think ultimately our mission is really, really awesome, and we attract really good people because of that. And I'm really excited to see what this field has for everybody else, because we can reduce the amount of one-on-one session by 42%. We're able to engage people 103% better than traditional models. And I think together there's a great solution that doesn't have to cost so much for the general person to feel better.
I think this is really, as someone who has many injuries under my belt, I think this is really interesting. And I think that, and that I'll fully own that that's like, personally, I'm like, oh, this is really interesting, because I know for me, even inside of injuries I'm dealing with currently, sometimes you don't know where to start. You feel like there's so many different options or so much different information or so many, and then you just don't do anything.
Absolutely.
Right. And then let's say you see a physio, just because that tends to be where I often start. Let's say you see a physio, and when you're there, it's great. And then they give you homework and you're like, I don't remember it. I don't know what to do. Like, it's all of these things. So it's almost like you're gamifying, I'm going to say rehab, but like gamifying whatever you want to call rehab.
Absolutely. Yeah, that's exactly what we're trying to do. And I think we're good ways there, and there's always room for improvement. And the product, expands, and every 2 weeks we get new pushes. I'm so excited about this one notification, one button, and it just drives engagement even better. And I think from an iterative model, I think we're doing all the right things right now, and I'm sure we can do more to make this process better. So we're able to now, if you go into a clinic now, a lot more hands-on treatments, and maybe acupuncture or shockwave therapy, like more advanced stuff to really push the needle, right? And at home, and for the basic stuff like low back pain, Zoom neck, and postural stuff, and post-operative care, even in many cases, it's very cookie cutter. And there's a lot of solutions already out there in the literature. We're just putting it together, synthesizing it, and then just putting a layer on it to engage you better, to make sure that you're doing the right things and incrementally, progressively getting better, and challenging your human self to better you, right? Feel better. And yeah.
Well, and it's interesting, because what I'm hearing you say, and correct me if I'm wrong, is that this is, because I'm always curious when we're doing things that disrupt sort of the traditional models that we've worked in. And those traditional models then go, oh my God, it's going to take all this away from me. And there's this pushback and this freak out, and all, you get, that's not going to work, and it's not safe, and it's not monitored, or whatever the crap is that they have to say. And what I'm really hearing you say is, listen, that's not going to go away, because there's always going to be complex injuries. There's always going to be complex things happening. This is maybe not at least right now, is not designed to replace that. But there's also so many people with foundational, straightforward injuries, pain, that don't need that to be, pushed into that full spectrum of whatever it looks like, and feel overwhelmed.
Absolutely. And, the problem with their system right now, I think, comes in a couple fold. So about 20, about 20 years now, they took physiotherapy out of OHIP. So prior to that, OHIP, Universal Healthcare, was covering physiotherapy and chiropractic care to a certain degree. So now you only get care if you're post-operative, right? If you have a certain amount of weeks. And then you also, if you're under 18 or over 65. But unfortunately, there's only a handful of clinics that actually do that type of work. And it's very cookie cutter. They're running like a process, like a factory, essentially, because they don't get paid well enough to do those one-on-one care. So, and then of course, if you work for a big corp or ever had a third-party insurance with like Sun Life or the Manulifes of the world, you'll know that your allotment for physiotherapy and chiropractic and rehab and massage care, they're getting dwindling down. Back in the days, like teachers, the government officials, they used to have unlimited physiotherapy. But people are struggling more and more these days. There's a high utilization right now, yet they have to pull these numbers back. right? And now you're seeing newer contracts coming through at like $300, $500, right, of limits to get somebody better. And the national average of treatments is 9 sessions on average of $80. How do you work out the numbers to get somebody better? And forget about just getting better, but also work on preventing and better health. Like there's none of that. That's happening, right? So just out of pain, you're out the door. And there's so many things you can do on a preventative model to I think from an active movement standpoint to reduce future injuries, right? Mm-hmm. Reduce better posture to feel better, just day to day feeling better. We know 75% of individuals with chronic pain have some kind of mental illness as well, so it fits right in. Your body's you got to treat it as a biopsychosocial model of care, right? And then I think overall, this whole notion of prevention and actual health model is really missing in our society, right? And OHIP is all about, and your primary care is all about a disease-based model of care. Mm-hmm. Go in when you have a problem. Mm-hmm. And then you got to go down this path of no return. And the longer you wait, the bigger the problem, the harder to fix, and leads to more sequelae, medication, cost of medication of that, and maybe possibly in future surgeries, the cost of surgeries of that. So like our job is to actually work on prevention. I think I mentioned we came here to create prevention, right? To start with prevention, but it's very hard. So we start at pain and then work towards prevention.
The team at Silicon Valley Bank in Canada can help you move your bold ideas forward fast, bringing global expertise to founders, investors, and innovators. Visit www.svb.com/Canada/Connect to find out more.
Wellness is such a challenging area because I think every insurance company in this country, countries, and the government systems talk about wellness and the importance of wellness over and over again. Right. And so I used to work in a previous life in health informatics, and when we used to talk about wellness, it was really like wellness, not in a whole system, you are going to be well to prevent things, wellness in the framework of let's minimize the stuff that's already happening for you. Right. And that is, from my experience, I'm out of the field now, but that continues to really be what they mean when they say wellness. They don't actually mean wellness in the let's prevent things. They mean wellness in we know this is a problem. How can we minimize the impacts of it going forward?
Yeah. I think it's important to take a stance on what you do. And I think it's also important to track what you do. I think data is really important, and health informatics, obviously, being in the field, you would know all about that. And that's what we do on the back end. We make sure patient progression is calculated. And how can we throw some AI engines in there to actually progress sets and reps and injury, progression of the exercise programming, and that's specified to you. And I think it's the smarter the system gets, the better the programming gets. It's actually better than I can do it because I'm not looking at all my patients like every minute of the day to see how they're doing. The system should flag me, right? And from a prevention model, wellness is a very odd topic, and I think it's really in the limelight now. Yeah, companies do not like to spend on wellness because it's fluffy, right? And it's like, where do you start? What do you mean by wellness? Do you mean by the psychology? You mean by the physicality? Do you mean financial? Right, that's lumped in as well. So, where does that stand? And how do you address that? Right. Yeah. So wellness is a tough, I think definition of health. So it's a really challenge to kind of figure out where you actually start with wellness. But I think if you work on a prevention model and start at a specific starting point and your goal to get to for the person, right? I think that's really important. I think right now still takes a very guided approach with maybe a practitioner on the other side to kind of get you there until our models, all of our models get better and better to work on what is the biggest limitation you have, with your chemistry as well as your physicality, movement patterns, and then how do you build specific things you can actually do on your own, right, at home in the comfort of your home, so you actually would do it and actually to do it to make sure that these things are preventing in the future, right? As you're even in looking at on the diabetes side, and sugar levels, right? So a great little research by one of the UHN, or working with the UHN as well, University Health Network, and Dr. Dinesh there and his crew that runs the Toronto Rehab. They actually looked at your blood sugar and how just doing a couple sets of squats throughout the day affects your blood sugar, A1C levels. It's significantly lower in that double-blind study for those individuals who can just break up their day, just to do a couple of squats.
Yeah.
Like simple movement patterning and those things come all together to solve a problem. But figure out what that problem is for you first, and then that's what we start with that conversation and assessment, if you will. And then from there, build a plan and strategic plan to get to that next step, incremental goals to get there. And don't throw everything at them first, like one small step and win there, and then slowly, incrementally build trust. And then overall, as they get better, they're going to feel better. Their energy level goes up, less pain, you're mentally more functionally better, right? And then, then you can take other steps on the fitness side, right? From there.
Yeah. So currently, I want to make sure I've understood this. So currently, Phyxable is really focused on people who have pain and getting them out of pain, pain-free, whatever that language is.
Mm-hmm.
But prevention is the future of what you're talking about with Phyxable.
We have prevention there now.
You are there now.
We have prevention there now. I would say majority of people coming in still initially, there's some kind of pain point, if you will, right? Just like any other business, there's a problem set, there's a pain point.
Yeah.
So our main ideal customer personas are, one, companies with a lot of injuries, like high injury companies, industrial companies. Like there's a couple of companies we're working with I can't name, but and also a couple that are looking at us that are more woke, I guess, in how they do things at work, and seeing like the cost of musculoskeletal at the workplace and seeing a huge return on the stuff that we're implementing. So high injury is one. And the other side, we're looking at more of the work from home models. Like this is huge stimulus, work from home as well as from work back to, or from home back to work models. And we're doing ergonomic assessments virtually, getting you in the right setup. And that doesn't mean like buy new stuff all the time. That means hacking your station to make sure that you're in a good place. And then we have even programming for that kind of points you, a couple times throughout the day to do a 30-second or a minute hit, quick little session to work on your hip flexors or posture, chest, to prevent these things from getting worse, right? So we work on both sides of things, the hard physical side as well as the prevention side of things.
Got it. So is this, it sounds like you have a lot of partnerships with organizations, but I assume this is something that like, let's say I have many injuries, may or may not be true. If I'm going to
we should do a mock session right now.
right. That's why I'm like, well, so as an individual though, if I have an injury or I'm interested in prevention, but like you said, pain point is probably going to be I have an injury or many if you're me, and I would like to, minimize the pain that I'm in or get past a plateau or whatever, this is something I can do individually as well. It's not only for companies. It just happens to be a model that works for both. Absolutely.
Yeah. In the Canadian model, yeah, absolutely. You can directly hit us up. In the States, you have to be in network, and that's a little bit more challenging. But in Canada, like as long as you have benefits or you can just pay out of pocket or credit card, you can jump on and do the self-help sessions that are on the preventive side, like posture, ergonomic fix. We have that. So there's different levels and sessions. You got to like pass one to get the next. You get points and stuff. So you have that. And then if you want to talk to a practitioner, you can start at Phyxable.com with the PHYXABLE. It's a physical fix.
Yeah.
So you can start there with a free consultation and we kind of walk you through, this is a good fit for you. We also want to kind of triage you. If there's something a little bit more sinister, we want to also, send you to the right place, right? Back to your family doctor or back to sometimes emerge. There's some stuff that we don't cover. And, but I would say majority, about, at least 85% of musculoskeletal issues, we do address.
Got it. I'm really curious about this. It sounds like this started with a Canadian focus and has expanded into the US.
That's correct.
Yeah.
And the UK we started with as well. But
So I am curious, because the audience for this podcast is a lot of entrepreneurs who at some point might be interested in expanding out of Canada or going into other countries, what have been some of the lessons that you've learned in doing that, or challenges you faced that maybe you weren't aware? Because I think sometimes we're like, we know there's going to be challenges, but then we're not really clear on what they actually end up being.
You know what? I think one of the key things is make sure your foundations are good, and like all the models that you have are very scalable, and it's okay to say not yet for those opportunities. And I would say we fell fall to that, and we started too early in the States, and we didn't get enough partnerships there to kind of land on the ground running. And we did it in the sense of like market research to figure out the need and understand the system really well. We were also we're backed by Startup Health as well, so they're a big conglomerate of startup moonshots in the world, and backed by Marquis Investor Dice and Jeremy. So we have a good mentorship and presence there already, but we thought we could just jump ship real quick and start ship, and it failed miserably, to be honest. And it took another try to really get a foot wet, and now we're creating partnerships with insurers they're here that have footprint here as well as footprint there to start with, and then we're bridging off to the larger insurers. So it's tempting to go really quickly, and I would just bring it back to foundations to make sure you understand one market really extremely well, when they're really really well, and say no to those opportunities, because it's going to screw you on an operational side, or it creates a lot of movement parts when you should be winning at one part and really niche in this one part and do it extremely well and really win those people over and have those people be your super fans and reiterate back. And then you can always go back to those other people. And what's better to say not yet to these people and drive a little FOMO along the way. And then when you are ready, you can always go back, right? And I bet you, if you're working with, like, especially on the B2B side of things, if you're working with larger companies, I bet you they haven't moved the needle when it comes down to your topic, right? So, take your time getting there, win at a market, see how you can duplicate in a similar market, and then go from there.
Yeah, I think that's great advice. I think it's often really tempting to go fast, and you can end up being spread too thin as a result if you're not really careful.
Absolutely. I totally agree.
So before we wrap this up, I always ask the question, is there anything that we didn't get to or you want to emphasize as we get to the end of the conversation? Is there something you're like, we need to talk about this still, or let's make sure that we don't ignore how important this piece of information was?
I think you alluded to, on the pre-interview when we were chatting, I think in regards to leadership, in regards to culture, I think also in regards to governance, right? So for those of you guys, starting out real early, and you have a small crew around you, make sure you take care of your small crew, and make sure as you grow, you drive that cultural piece from the beginning, and have those components of not just growth and having to, kill it, to making sure your current operations and foundations are good. And, I fell straight to that as we're growing. And, early on, we lost a lot of people, different types of people. And we have to, especially now being, the hiring frenzy right now being very, very difficult. I would just make sure you're watching your own current people, make sure they are happy in regards to where they are. And that comes from you as founders, and you got to lead the way, and making sure, like, being a founder just does not mean growth. It means good foundational growth and incremental growth that you can sustain and be able to now, really, build from that and hire really great people along the way. And then your people will tell the other people, the great people, how great this is to grow. So, as you go from 0 to 1, I would make sure that that governance and those small pieces are there, and build it into your overall culture as you're scaling your product or your service.
I love that. I think, listen, my bias is towards leadership and culture, so I always appreciate ending on leadership and culture. And I think that, what you're saying is really true. It's not just what you do, it's how you do it. And that how can be really hard for founders, especially as they are growing or in those early stages, to be mindful of, because there are so many things you're trying to be mindful of, but the how matters. It really does.
Yeah, absolutely. And get the help. It's okay to say, I need help. And being a CEO, being at the top is so lonely. It's extremely lonely. And it's hard to ask for help because you want to seem like everything's all good, but get good mentorship. I sit on two forums for this purpose and have good advisors to really rip me apart, right? And you need it sometimes. And then and trying to take, this is where the mindfulness comes in and work on your meditation, be a little bit mindful, not reactive, and then looking back to see what are the things that you're actually missing. And if it hits you a couple times over the head and you're still not getting it, then maybe there's a bigger problem in mind to get your head on straight to make sure that the whole ship is moving well forward.
Yeah, that's great. I really appreciate that insight and you sharing that. So I want to, thank you very much for being on the show today. It's been really wonderful to chat with you and get to know you a little bit. So thank you for your time, Jim. I appreciate it.
Thanks for having me.
Absolutely. And to all the listeners, thanks for listening to Canada's podcast. Like, comment, and subscribe to all our channels to get the latest podcasts from entrepreneurs across Canada.
The Silicon Valley Bank team in Canada can help you take your next step. Find out more about the bank that has nearly 40 years of global experience supporting venture-backed tech and life science companies and their investors. We're in Canada to help leading innovators reach the next stage faster. Visit www.svb.com/Canada/connect. Take your next step with Silicon Valley Bank.